Honestly, I really started paying attention to BPA when I had kids. You know, as a new parent, you just start having questions about the kinds of things that you want to give your kids, and you know, you're trying to be really careful about everything. And so I just started doing some research about what kinds of, you know, products or like sippy cups and bowls and stuff like that I could give to him that wouldn't have the BPA in it.
There's been more than 200 different scientific studies that have found a link between bisphenol-A, BPA, at very low doses, and a whole host of health ailments, from prostate and breast cancer to obesity, altered brain development, cardiac disease, diabetes, and early puberty. And so we felt like there was enough evidence to demonstrate that there's a risk in using this particular chemical. It gets in pretty easily when you orally. So if it's in a cup and you heat up the cup, then that chemical gets into the liquid, and then you suck it down, and that's one of the easiest ways for it to get into your body.
I just thought it was crazy that for children, for infants and small children, that this was an issue, that there would even be something like this in products for kids. Like, that just didn't make any sense to me.
It can appear in baby bottles, water bottles, the lining of metal food cans, and in fact, it's so prevalent that the Centers for Disease Control and Prevention have determined that 93% of Americans have detectable levels of BPA in their bodies. BPA, as I understand it, is a chemical that can be flushed out of your system pretty easily, so the fact that so many of us have it means that we're constantly being exposed to it. This year we were working on other issues, but then we heard that Representative Kagan from the Denver area had actually already gone ahead and introduced the bill, and so we decided to jump right in and support it, since it was an issue that we'd been thinking about supporting for quite some time. The American Chemistry Council testified against the bill. They're, as I understand it, a representative body of industries that produce different kinds of chemicals. They believe that this chemical is still totally safe. And so, you know, they cited a number of studies that they, you know, think prove that this chemical is actually not a unsafe chemical. They also said that there's the movement to remove BPA from a lot of these kids' products, and in fact said that most of the kids' products that we were targeting did not include BPA anymore. And unfortunately, the committee voted to not pass the bill, and so in terms of this particular legislative session, that policy isn't going anywhere. We realized 11 other states have actually taken action banning BPA from specifically baby bottles, sippy cups, those sort of items. And a number of municipalities. The city of Chicago has done this, as well as a few others. But in those states, legislators decided to err on the side of protecting kids' health rather than erring on the side of allowing these chemicals to be, you know, in products.
If you don't have time to go to 3 different places to look for the right kind of bottle, you're going to just get what you can get wherever you are. And so I think that it's important that every person has the right to safe products, no matter where they're getting them. I mean, it's just crazy that it's even an issue.
Usually bills are introduced in January, so we anticipate it'll be introduced in January, and then it'll be talked about again in February. And then, you know, if it gets through the committees and the process, it usually takes a month for a bill to go through, so it'd be February and March. So, you know, whether it's Representative Kagan or somebody else, you know, there's obviously a big election, and so we'll see which representatives are there, but we're confident there'll be someone who will be interested in prioritizing kids' health again, and we certainly are excited to work with them. The consumer should shop with their feet and go and shop with their wallets and go to the stores that are selling BPA-free items and to buy items that are clearly labeled BPA-free. It sends a clear message to those businesses that that's where the profit is and that's where they're going to go if that's the case. And it also helps to push businesses to just increase their own transparency, and not just the companies that are selling the bottles, but the companies that are stocking the shelves. The more that parents are bringing these ideas up to those stores, the more that those stores are going to turn around and ask the businesses, we'd like to only stock ones that say BPA free.
I taught in Denver public schools for about 3 years, and I met so many parents who were doing the very best they could to just even put dinner on the table and, working 2 or 3 jobs. And I know that they didn't have time to think about stuff like what's in the products that my children are, eating with. There's a variety of products that are available that are BPA free, but if you don't know to look at the label, then you could still be buying products that have BPA in them.
Parents should be, communicating to their representatives that this is an issue that concerns them, that they know other states have taken action on this and Colorado has not. And so the more that legislators hear from their constituents, that makes a big impact.
We shouldn't have to be concerned about whether or not there are harsh chemicals, I guess, in baby bottles and stuff like that. It just shouldn't be something that parents should have to worry about. But it is.